Wonderful. Thank you for joining us. I see people are still coming in. And so I'm just going to cover some housekeeping items, and I'll circle back to remind those that maybe aren't with us yet today about those items. So we are here to talk about Count the Kicks and Saving Babies with Us, a guide to talking to expectant parents about fetal movement monitoring. As far as housekeeping for this webinar, it is being recorded, and that link is going to be shared with you. So there will be a link to the recording and also a PDF of our PowerPoint presentation that will be sent in a follow-up email later today or early tomorrow. So do know that if you're a note taker, as I am, great, but you don't have to write everything feverishly. We will make sure to share emails, contact information, again, a link to the recording and the PDF and a survey. So please know that that is out there. You can use the chat function to place questions. When we're in present mode, we may not, one of us may see it, one of us may not. We promise to go back and answer all questions at the end. We'll have a time for a Q&A. We're going to do our best to stay on time. So we're going to get moving here because we do have a lot to share with you today. And again, thank you for joining us. My name is Jen Rowry, and I'm the Director of Advocacy and Engagement for Healthy Birthday, Inc., which is the 501c3 nonprofit organization that runs the public stillbirth prevention campaign, Count the Kicks. And I've been with the organization now for 4 years. With a background in education, I believe strongly that knowledge is power, and the information we're going to share with you today is knowledge that every expectant parent deserves to have access to. And I am thrilled to be joined today by Miss Nneka Hall, and I'm going to pass the torch to her and let her introduce herself.
Thank you, Jen. Hello, everyone. I'm Nneka Hall. I am a Count the Kicks Massachusetts ambassador. I've been an ambassador. Well, I've been an ambassador really since I heard about Count the Kicks, but formally I became an ambassador because of their great baby saves and their Iowa stillbirth rate declining, most specifically in the Black communities since I think it was November of last year. I'm a full spectrum doula, maternal health advocate, founder of Quilt, Quietly United and Lost Together, founder of Mother is Supreme, Inc., and mother to Jelani, Simone, Anaya, and Bradley. Take it away, Sam.
Hi, everyone. I am Samantha LaCroix, and I am honored to be Count the Kicks ambassador alongside Nneka here in the state of Massachusetts. And I joined Count the Kicks as an ambassador about a year and a half ago. And I really did this in honor of my son, Xavier, who was stillborn in 2012. Goodness, it's terrible. 2012 at 41 weeks. And I really am here to make kick counting as common a practice as taking a prenatal vitamin. So I'm looking forward to sharing this all with you.
Thank you, ladies. To get started, I think we have a great video, a feel-good video that gives you a great overview of Count the Kicks. It highlights our free Count the Kicks app and the power of mom-to-mom sharing and the power of moms being educated. So today, when you watch this, I want you to draw your attention to the symptoms, the signs, the warning signals that Mom Emily talks about here. We're going to go back and talk about that, and we're going to talk about our app more. But for now, let's hear about how Emily got Ruby here safely.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So let's talk about how we actually hope to save more babies together. We have a highly effective, evidence-based stillbirth prevention campaign, and we've developed early warning signs for moms that they can use and reference. And as you just saw, we've saved 1 in 3 at-risk babies in Iowa. And the best part is our campaign is ready to go and a really low cost.
So before we get started, I think it's really important to level set and make sure we're all talking about the same thing. This is a stillbirth prevention campaign, and a stillbirth is defined in this country as the loss of a baby after 20 weeks of pregnancy up to the end of that pregnancy. So a miscarriage is up to through the 19th week. Stillbirth begins 20 weeks to the end of pregnancy. And infant mortality is a baby that takes a breath birth side and passes within its first year of life. Stillbirth also is broken into categories, both early, which is that 20 to 27 week category, late stillbirths occur 28 to 36 weeks, and term stillbirths occur between 37 and the completed weeks of pregnancy. I want to note, and we'll address this maybe a little bit more later, but the risk of stillbirth actually increases closer to someone's due date. So it's extremely important in that 3rd trimester, which is the 28th week, that we start really paying attention to kick counting, and 26 weeks for high-risk moms, which you're going to hear more about today. So we actually lose more babies in this country to stillbirth. We lose over 23,000 babies a year to stillbirth in this country. And we lose 22,000 to infant mortality. Both are horrific, both need to be addressed, but we want you to know that stillbirth is much more prevalent than is talked about in this country, and we have to start shining a light on that and talking about it. And that's one reason why we're here today.
National data shows prevalence of stillbirth and unacceptable disparities. There's 1 in 169 pregnancies end in stillbirth. Racial disparities do persist. Black moms suffer a loss to stillbirth at 1 in 96. Hispanic moms, 1 in 199, Indigenous moms, 1 in 138, white moms, 1 in 204, Asian Pacific Islanders, 1 in 233. It's just as prevalent as infant mortality. Families are 10 times more likely to lose a baby to stillbirth than SIDS.
Is talking about it. And if we look here at the state of Massachusetts, our stillbirth rate is 4.31 per 1,000 live births, which really is looking at 1 out of 206 pregnancies in Massachusetts ending in stillbirth. So we're really seeing 314 babies lost to stillbirth each year. I want to pause. This is the equivalent of looking at kindergarten classes being lost, a kindergarten class being lost every single month. To me, that really hits home. If we could save 1 in 3 at-risk babies in Massachusetts, like Count the Kicks did in Iowa, then we would be saving 100 babies a year here.
So we'd love to see that number change in Massachusetts, like this slide shows in Iowa. That's why we're talking today, is talking about what Count the Kicks has accomplished in Iowa. So Count the Kicks is a evidence-based campaign that was brought to Iowa actually by 5 women who lost their daughters, to, 4 of them to stillbirth, 1 to infant mortality. And they came together to grieve. They came together to support one another. But they also had some real similarities in their stories, and they had some real concerns with the answers or lack of answers that were there. And one of the things they noticed is that there was a gap in data being collected. So they went to work, and that is really how, and we'll talk about the evidence behind Count the Kicks in a little bit, but it's really how we came to be an organization. And so there was a soft launch of Count the Kicks. If you look at this graph, you'll see different things. So the red line that's coming across the top, that is representing US national data. And notice that it has remained fairly high, fairly stagnant. There was this interesting dip. And then we likely will see a major spike because COVID-19 has not played nicely with expectant parents. We also see these blue dots representing Iowa's stillbirth rate over time from 2003 actually until 2021. And that dotted trend line represents the downward trend of stillbirth in the state of Iowa, where we have experienced saving 1 in 3 at-risk babies, that 32% reduction. And as NECA said, that in the first 5 years of our campaign, we actually saw a 39% reduction for Black women in our state. And so we want to see this happen in every state. We want to see that downward trend line. Yes, there are outlier years. In a low birth rate state like Iowa, for example, a syphilis outbreak, an infection outbreak could impact the stillbirth numbers. And so we look at 5-year averages a lot, and we do that around the country as well. And so this is, we are looking at 2021 during COVID and 2020 data in Iowa remaining good and even continuing that downward line. And so that is really exciting to see. And we just hope that that is what we're going to be able to bring to all the states that work with us.
As mentioned on the previous slide, there's a large divide when it comes to those who are more likely to experience a stillbirth. I wanted to take a moment to share what research has shown to be some contributing factors to this. Please note, Healthy Birthday Inc. has reviewed research articles, and these points come from various articles, and we would be happy to share these with you if you're interested. Research shows that there are a lot of contributing factors to the racial health disparities in stillbirth. Researchers point to the following as causes of disparities: systemic racism, toxic stress. Research shows that years of being treated unequally and or unfairly essentially bring an African-American woman in a systemically unjust society. And all that comes with it have led to real and pervasive health issues for Black women. Epigenetics, physiological variations that are caused by external or environmental factors that switch genes on and off and affect how cells read genes instead of being caused by change in DNA sequence. Predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, preeclampsia, or high blood pressure, which all are linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. We also see access to healthcare, socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. You may wonder what Count the Kicks is doing to reduce disparities in stillbirth outcomes. Well, there is a health equity coordinator on staff to ensure we are looking at everything we do with an equity lens to ensure we're able to connect to the people and to those who serve expectant parents who are more likely to be impacted by poor birth outcomes. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. One of the ways we utilize funding is we translate our app and brochures to meet the needs of those who don't speak English. We are an inclusive organization with 100% board and staff training on anti-oppression and structural racism. We work within the communities considered to be marginalized by improving programming based on lived experience shared with us by people of color. As we learn more about the issues, we identify solutions and work with our partners on implementation. Our app is now in 14 languages. It's culturally appropriate educational material. We even have low literacy brochures that are more picture-based for those where English is not their first language. We have also created videos featuring women of color so that they're able to connect with the face they see, as well as updated on our printed educational materials and facts, FAQs, in multiple languages.
Thanks, NECA. Next, I would like to talk about the research and evidence behind kick counting as a best practice in stillbirth prevention. So I mentioned that these 5 Iowa women came together and they were the founders of our organization. So 2 of them were actually in Washington, D.C. at a conference on stillbirth, and they were presenting on the stillbirth registry that they helped create with then Iowa Senator Tom Harkin in the state of Iowa, the first stillbirth registry in the country, which eventually led to the work of other states creating a stillbirth registry and a national registry at that time. But while at that conference, 2 of our founders, Janet and Tiffin, listened to a presentation done on a study out of Norway. And in that study, it essentially took a cohort of expectant women, educated them on tracking movement in the 3rd trimester, learning their baby's normal movement pattern, and to speak up if they noticed a change in that pattern. Amongst that cohort of women, and on the flip side of that, providers were a part of this. They were educated. They were educated to pay attention to the concerns of moms who spoke up and help investigate if there was a concern. And so as a result, what they found in Norway is a 30% reduction in stillbirths in that cohort of women. On that study was in your area, Dr. Ruth Fretz, a Harvard Medical School professor, a practicing OB, who continues to be an advisory board member for Count the Kicks. And I love the quote that she says here: tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancies. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern, starting at 28 weeks, and to speak up if they notice a change. If you take note, on our slides, as NECA referenced a minute ago, we do have the research, and our website is full of the evidence and research. So if you're one of those individuals that'd like to get your eyes on those studies and that information, every slide does have the information from where we took this presentation information. So you can go to our website, look that up, or look it up by Googling it as well. So that will be on the PDF slides that we share with you. This is when Janet and Tiffin, the founders I mentioned that heard this research study, said, that's it. That's what we want to do. We want to save babies. We want no other family to go through what they went through. And that was when Count the Kicks was born.
Thank you, Jen. And I love that they started this mission. And what's even better is that we've been named a best practice. So AMCHIP, the Association of Maternal Child Health Programs, after going through a thorough scientific review, they determined that our program meaningfully engages stakeholders at all levels of practice and ensures improving health equity is an integral component of overall program sustainability, has been externally validated by another entity and replicated with similar positive results in another context. Count the Kicks is a proud AmChip member, and we hope some of you or all of you will order our materials, download our app, share and engage in other meaningful ways to really help prevent stillbirth in the state of Massachusetts and throughout the country. Another way you can help us prevent stillbirth and save moms is by sharing the CDC's Hear Her campaign warning signs for pregnant moms. What are some of those warning signs? So there are 15 urgent warning signs for pregnant women to pay attention to. And one of those is baby's movement, a key marker. And again, this is where Count the Kicks ties right in. So this is something else that you can be sharing with an expectant mom.
So let's quickly talk about the app. So one of the things that we sometimes hear is that I don't want to scare women. I don't want to increase their anxiety during pregnancy. And that's a valid concern, right? So we and many others have studied kick counting and the emotional or mental impact on moms. In fact, it says one potential side effect of routine monitoring of fetal movement could be an increase in perinatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true. Usually the fetal movement count is actually reassuring to pregnant women and prevents unnecessary visits. In fact, we've partnered with the Harkin Institute and Des Moines University here in the state of Iowa to do a study on our app users and a response to surveys that were sent out to them. And what we actually found is that 77% of our app users actually reported feeling less anxious, not more anxious, but actually reported feeling less anxious as they were in tune with their baby and their body. I would guess women in rainbow pregnancies after loss find this app to be vital. 84% of women in this study also indicated that it increased their associated feelings of bonding. Their associated feelings with bonding are huge. This can help make that pregnancy experience obviously better, but going into that postpartum, when you actually bring that baby here, to have that bond with baby will help reduce childhood ACEs, help mom through that postpartum period, and we know just make a healthier union and family altogether. And so we believe actually that the opposite is very true, that most women who are educated to kick count find that to be reassuring. Moving on with this concept, we also know that we have heard stories and we believe that we can be a solution to actually the preterm birth rate. And let me give you an example of this. So our own executive director, before she ever worked in stillbirth prevention or with Count the Kicks, was actually a local news journalist and did the very first story on the launch of Count the Kicks by interviewing the founders I just spoke with. She was educated during that process about the importance of tracking a baby's movement in the third trimester. Well, about a year to the day later, after that story aired, she was 30 weeks pregnant with her first child, a son, Hayden. At that time, she noticed that he had a decrease in movement, a change in his movement. Because she was educated that this could be a warning sign, she spoke up to her provider, who listened to her, took her concerns seriously, and had that investigated. Unbeknownst to Emily, her body was in preterm labor. She was actually preparing to deliver a baby. It wasn't contractions or pain or other warning signs that alerted her to a change. It was her son's movement. Because she spoke up quickly, because it was taken seriously and investigated, they were able to stop her contractions. Bed rest and medication brought that little boy here at 40 weeks gestation, and he spent not one day in the NICU, is 100% healthy. We also believe that kick counting can help identify fetal growth restrictions earlier. We know that babies that have a fetal growth restriction in utero, typically their health declines over time. And so you want to catch that as quickly as possible. What's interfering in that pregnancy? Why is that baby not getting the nutrients or the blood supply that it needs to grow and thrive? So we believe it can be a solution for that. And finally, we also believe, and we're going to talk about on the next slide, that tie to maternal mortality and morbidity in stillbirth. And we believe that we can also help save women, not just babies. One thing I want to point out on this slide, it says women who have a stillbirth are substantially at higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. And so there is a tie between stillbirth and the health of mom. So our nonprofit, Healthy Birthday, just released in April a white paper on this very topic, the link between stillbirth and maternal morbidity. Firsthand accounts from 8 American women on the damage to their health. I would like to share one more story. We have a great story out of the state of Ohio, a baby that was saved by his mom being in tune with her baby and body. So mom was a 4th-time mom, not a new experience for her, not new to pregnancy. She was also a nurse practitioner who had a pretty high health literacy herself. She was tracking son's movement. His name is Rocco. And at the very end of her pregnancy, she noticed one day that his movement had changed, and with some encouragement from her husband, quite honestly. And sometimes women need to be encouraged by their support systems, by their providers. We need to make sure that they feel comfortable speaking up. She contacted her provider when she noticed a change in Rocco's movement very close to the end of her pregnancy. When she got to the hospital to investigate what was happening, they did the normal, hooked her up, checked everything out. And what they immediately discovered is that, unbeknownst to her, her blood pressure had skyrocketed, and she had a severe case of preeclampsia setting in. She never had blood pressure issues before. She did not tie kind of waking up that day and feeling a little blah, a little off. She tied that to, I'm very pregnant with my 4th child, have a full-time job, 3 small children, when in reality, she ignored the warning sign that her body was sending her, but she did not ignore the sign that her son was sending her that there was something going on. We know that there is this heavy link between mom and baby. They're intrinsically linked. What we know also is the United States is not doing well in this category. So the US and the United States, the rate of maternal morbidity and stillbirth is higher than other well-resourced and developed countries. And research shows that the risk of severe maternal morbidity is more than 4 times higher among stillbirth deliveries compared to live births. 4 times. So they're very tied. Mom's health, baby's health, very tied together. According to one study, more than 15% of maternal deaths within days of delivery occur in women who experience a stillbirth. We also know there are vast disparities in the information about who suffers severe maternal morbidity and mortality. And unfortunately, Black women also are finding themselves, and brown women, in the crosshairs of severe consequences as a result of pregnancy or right after delivery. And so we need to be talking about this, but we also would love for you to scan this. I'll share a link to this white paper with you so that you can learn more about the ties between stillbirth and maternal morbidity and mortality. Sam?
So now that we understand sort of the why behind what we're doing, our next step is to really identify how to implement Count the Kicks by teaching your clients or patients how to monitor baby's fetal movement in the 3rd trimester through the use of our free Count the Kicks app. So let's start with, why does movement matter? As Jen has touched upon, movement is one very important way a baby communicates before birth. And really, a change in a baby's movement can be an early sign of distress, and sometimes the only warning sign that baby may give when there's a problem. And this is something I experienced with Xavier, but I wasn't educated on kick counting. I didn't pay attention. I didn't speak up, and I didn't advocate for my baby. So when you think about it, a baby during pregnancy is just like all of us. When we're not feeling well, we've got a fever, a bug, a cold, whatever it may be. We're not running around doing a million things unless you're a super parent. We typically are laying in bed on the couch instead of being going out exercising and doing our normal routines. We take time to slow down. babies' movements may become weaker when they're in a time of distress. Again, they're recognizing something's not right and they're going, oh gosh, I'm going to conserve all of my energy and focus on the vitals, right? So they're preserving the blood flow to go to vital organs such as the brain and heart to conserve energy and self-protect. So this is really where the heartbeat fading or decreasing can be the last sign of distress, because again, all these other things have already happened. So there are really 3 types of movement changes that we want to be aware of. One, reduced fetal movement in general. Baby has fewer or no movements. They are noticeably slowing down. 2, reduction in strength of movement. So baby may move, but the movements are softer or weaker. They're not those hard jabs that you may have been getting before. They're little taps. And then conversely, a sudden wild surge of movement can also be an important sign of distress. And that could be where the cord perhaps is tightening a knot in the cord or something like that. So since we know kick counts matter, let's actually start getting moms counting their kicks. When should that happen? We're really saying at the start of the 3rd trimester, 28 weeks gestation. If this is considered a high-risk pregnancy, then we would be talking about 26 weeks gestation. And this is when research baby has established a consistent pattern that mom can actually feel and track. And what does mom need to pay attention to and track? What counts as a kick? Anything like a roll, a kick, or a jab, really not hiccups, because those are considered involuntary movements. So with that, we'll kick it over to NECA to really give us the lowdown on the app.
Thank you, Sam. So let's talk about our free Hallmark tool, the Count the Kicks app. Our app has been downloaded over 180,000 times in over 140 countries. First, let me note that there are no advertisements or pop-ups on our app to distract mom or to slow her kick counting sessions. We regularly survey our app users and listen to their feedback to make any changes or improvements. Once again, our app is free and it's available in 14 languages. It is also available for Apple and Android. If you get interrupted during a kick counting session, you can restart your kick counting session or delete a kick if you accidentally track one. We're all busy, busy, busy. And if you're anything like I was when I was pregnant, pregnancy brain is a real thing. You can set up a daily reminder to help you remember to count those kicks. After a few days, you'll begin to see a pattern for your babies or your baby, how long it takes for them to get to 10 movements. You can review your kick counting history, download it to share with your provider so that you can discuss it at your appointments. Your kick counting history can be useful for visits with your provider. The app also will track future pregnancies, so you don't have to create a new account with each pregnancy. You can manage your account on multiple devices, including the Apple smartwatch. Remember, if you or your client does not have access to a mobile device, you can also do the same thing with our downloadable Count the Kicks chart by going to our website. We have added a new strength tracking feature because research shows expectant parents should be paying attention to the strength of their baby's movements while counting and tracking their kicks. Oops. With our new strength tracking feature, at the end of each kick counting session, you'll be asked to rate the strength of your baby's movements. If your baby's movements become weaker, it can be a sign that your baby needs to be evaluated. This new feature teaches us how to judge the strength of our baby's movements. We also have new video capabilities to inform us and educate app users on how to count their baby's movements. Why counting kicks is so important, as well as a short tutorial of any future features on the app. And you see this right here, you can take out your phone and you can take a look at, oh, wrong slide, sorry. I'll move on. I get so excited about telling people to take out their phones and see how easy it is to get this material and to share with others. Next slide, please. We are excited to announce that we've recently launched a new resource on our app in the resources section in the menu. Users will be able to access this website, healthybirthday.findhelp.com. The users can enter their zip code and search for free and reduced cost services they need. Perhaps they're looking for Section 8 housing, or a local doula, or food banks in their area. The list on this website is constantly being updated, and we look to others to let us know if a service or org is missing on the list. So if you notice that there are any key organizations that need to be listed on here, please let us know. And for those of you from an organization today, please let us know or go on to the site so that you can upload your information. The app is now helping to positively impact the social determinants of health during pregnancy as one way to improve birth outcomes. Let's watch a short video together so you can see how easy it is to use our app.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
As you can see, it's easy to use, takes out the guesswork of remembering how long it takes, and empowers moms to speak up if there is a change. Jen?
Thank you, NECA. Let's talk now. We've talked a lot about Count the Kicks, some of the tools and resources like our app that we have, but let's talk more about integrating Count the Kicks into the system that you have. So we have a variety of individuals in our audience today with different expertise and backgrounds, everybody from maybe nurses, providers, to state health department workers, to community-based workers, to doulas, whoever you are, we're super appreciative of you being with us today. I think it's really important to talk about health literacy at this point. And I want to just say, did you know that health literacy is actually one of the strongest indicators of an individual's health status? How they can navigate what they understand and how they can navigate the system is really important. So a healthy dialogue is a key to prevention. And I would like to talk about 5 ways to improve the conversation you're having with expectant parents, all expectant parents. So be equitable. Everybody, no matter their race, religion, their socioeconomic status, their sexual orientation, their marital status, their education level. I don't care if it's a GED or a PhD. Every expectant parent deserves to understand the importance of kick counting. And you assuming that the other individual has that knowledge based on any other factor really removes the opportunity to have an important conversation. So we want you to make sure that everyone has this information and that you're providing equal information to everyone as well. We want you to listen and learn. Think about asking strategic and open-ended questions, not those closed-ended questions like, is baby moving? Well, that's a yes or no. I have several ambassadors that talk about that was the only question they ever heard, and they assumed everything was okay when they said yes. But is baby moving normally? Did they know what their normal was? Did anyone talk about this being a red flag or a warning sign? Was there further discussion with open-ended questions? Most of them will tell you no, and that caused confusion. It sent the message that it wasn't that important and everything was well. So we want you to listen and learn based on the answers that are being given to you. Be clear and concise. Avoid long and complex explanations and medical terminology. Consider using everyday vocabulary. Meet the audience where they're at. Make sure that it's clear. And don't go into things like fetal movement monitoring. Talk about counting your baby's kicks, for example. Be honest. Speak the truth while still practicing empathy and compassion. We know that having a conversation about stillbirth is hard, but honestly, isn't having a conversation about breast cancer hard? Isn't having a conversation about if you don't take your folic acid, there could be brain development issues, that you're at very high risk of miscarriage. There's so many things. If you drink this, fetal alcohol syndrome could come to your baby. There are so many things that we talk about that are hard, but it's important to have preventative conversations. And that's exactly what kick counting is. It's preventative medicine. It should be a standard of care. And so although the concept of stillbirth is hard to talk about, it's important to talk about. Again, we talk about gestational diabetes and we take those tests, not because we want people to be afraid they're going to get gestational diabetes, but because it's important to getting them through a pregnancy healthy and their baby through a pregnancy healthy. Make sure you reteach. If someone's just not dialing in, there's a barrier, there's confusion, a lack of understanding, reteach. If they need extra support, what supports can you connect them to? So this important conversation, and I want to just highlight one thing, it is, if you are a nurse, a provider, anyone in a doula, anyone in that like healthcare team with an expectant parent, it is vital that you give them permission to speak up and to trust their instincts. You literally will save lives because women won't question themselves. They'll feel like they can have this important conversation and they're more likely to speak up. Sam?
So, as Jen said, we know and understand that talking about stillbirth is not something anyone wants to do, but it is so important. Expectant moms hear about all sorts of different things that can happen to their baby. And this should just be another conversation that's part of that routine exam and conversation with expectant moms. So we've heard, I don't want to scare anyone. Well, pregnancy is full of risks that we talk to expectant parents about, and stillbirth should just be another touch point in that conversation. We also hear stillbirth just happens. There's nothing we can do, but there are things we know we can do. There can be warning signs if mom is educated and empowered and knows what to look for. We've heard her baby is always active, so it's not a concern. Well, babies are active until they aren't. Cord and placenta accidents can be sudden. So again, mom needs to know what's normal for her baby so that she knows when there's a change. And then she's almost at her due date. And this is where the risk of stillbirth actually increases as a mom approaches or exceeds her due date. Nneka?
A lot of times we get questions about what to do or say when talking about fetal movement monitoring with women who have experienced a stillbirth. Well, speaking from experience, I can tell you that my pregnancy after losing Anaya was intense. And I thank God for my provider, who was absolutely wonderful. So when you're talking to a mom who, or moms who have had a previous fetal demise or stillbirth, follow the same protocol. Read the chart prior to entering the patient's room, or even prior to the time that they arrive. Since women who've had stillbirth or had a stillbirth are more likely to experience another stillbirth, talk about starting to track babies' movements at 28 weeks versus at 26 weeks versus 28 weeks. Feel free to talk about the previous stillbirth and acknowledge her child that was born still. Ask name, gender if you weren't, her previous doctor or provider. Stay away from medical terms like fetal demise. Be empathetic. Ask if anyone has talked about the importance of tracking fetal movement before. A lot of moms, we talked to that have a previous live birth have stated that they were told about the importance of tracking fetal movements. So here are a few common myths that we find. My baby is always active, so I don't need to count the kicks.
Inactive babies can experience distress, sometimes quickly and without other warning signs. Tracking a baby's movement every day takes the guesswork out of knowing if a normally active baby has slowed down. And count the kicks gives you real data to show your healthcare provider if you have a concern.
Only those experiencing a high-risk pregnancy should pay attention to their baby's movement.
I want a buzzer. False. All expectant women should be educated on count the kicks and get to know what's normal for their baby.
I will interrupt and say this. Most of our ambassadors that have lost babies were not in high-risk pregnancy prior to that loss. And so all expectant parents deserve access to this information.
My baby should get 10 kicks in 2 hours.
Again, this is false. Every baby is different, and the recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates moms should work to understand the normal amount of time each day it takes for their baby to reach 10 movements each day.
I can just use a Doppler device to monitor my baby's well-being.
No. False. Again, a change in a baby's heartbeat is one of the last things that occurs when a baby is in distress. We talked about that earlier. A change in a baby's movement may indicate potential problems before actual changes in the heart rate are detected. So expectant parents should only use a Doppler device under the guidance of a healthcare provider. So if a baby isn't moving, I should drink cold water or eat something sugary to get the baby moving.
False. Research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are best monitored without interventions like juice, candy, etc. If baby isn't moving like normal, parents should speak up to their provider right away.
Babies kick less near the end of pregnancies. By the way, I believed this.
So did I. No, babies don't run out of room at the end of the pregnancy. The types of movement may change, more jabs, fewer rolls, but babies should move up to and even during labor. If an expectant parent is monitoring their baby's movements at the same time each day, it should take about the same amount of time to feel 10 movements.
Triage doesn't need any count the kicks education.
That's false. Labor and delivery triage is the perfect place to have this information. Posters, brochures, and discharge papers all should be used when someone comes in for anything and is sent home.
So I actually want to talk about that because I went to L&D about 6 or 7 times with my rainbow baby, Oliver. Because I had lost Xavier, I was terrified and didn't know what I could do to save my baby. So whenever I was concerned, you know what they said? If you have concerns, come right in. Great advice. I was driving from Randolph to Boston to get my baby checked out at L&D at like 2 a.m, multiple times, because that's when I would freak out. So if they had had this education on hand, I probably could have saved a lot of stress and midnight drives. So pregnant people should avoid dental care.
False. Good dental health is always important. Pregnancy can increase an expectant parent's risk of dental issues, thus overall health issues.
So whoever you are in our audience today, you've been getting a lot of great information. Now let's think about how you implement that, right? What kinds of systems changes? You know your system best, whether you're in the healthcare profession or a community-based organization. Where are you going to weave this education in? How are you going to get it in the hands of expectant parents and other healthcare providers and teams? Think systems change. I highly recommend that you connect with your community. All community-based organizations, anyone that's intersecting with expectant parents, need to have this information and be that like another touch point to make sure that everybody has access to it. Make sure you have all your front desk staff trained. The person answering the phone oftentimes is a gateway, right? And they can be a good gatekeeper or not. And so if they don't know how important a phone call from an expectant parent who has a concern on movement is, they may triage that, and that person may get a phone call 3 hours later. In fact, our Minnesota ambassador talks about this happening to her, and it delayed her. Then she got a phone call back 3 hours later that said, come to labor and delivery triage. When she got there, her baby didn't have a heartbeat, but still had brain waves. So it's so important that this gets responded to immediately, and that everybody knows that when a concern is presented, that it should be checked out and that we should not be put in a call queue or delay at that point. Where can you include it in your intake forms or your family care forms if you're in one of those community-based organizations? We believe that if you're in a clinic setting or medical setting, glucose testing is actually the perfect time. So you can give this in the prenatal packet, that, you know, welcome to pregnancy packet, but that's the first trimester, right? So this needs to be brought back out closer to the 3rd trimester. No better time to do that than when they're sitting there in their glucose test. They have time to download the app. There's lots of education there, and they can get started in kick counting on that very day. Having your emergency medical records or health records updated to make sure that every appointment the 3rd trimester, the kick counting conversation is happening. And going back to what we talked about, open-ended questions, education, making sure you're having a healthy dialogue, but making sure it happens at every touch point in the 3rd trimester is vital. And again, giving a voice to the patient to trust themselves, their instincts, and that you want to hear from them if they have a concern. Please add to consider if you have like a hold. You know, when I call in the doctor's office, I get put in a call queue, I'm put on hold. I hear all kinds of things like, come to this walk for that, or check out, you know, this hospital system's website, or whatever it might be. Why not put a little bit of Count the Kicks education into that hold or that call queue phone recording when patients are on hold? So NECA, you want to talk about this? I'm super excited for you to be the one to share
it. Thank you, Jen. So now what? Well, now you have a background on Count the Kicks and how to talk about it with your patients or clients. Now is the time to order. Everyone, take out your phone. If you take out your phone and scan this QR code right now, as you can see, the you know, thanks to our partnership with the Massachusetts, well, thanks to wonderful things that we've done here in Massachusetts, the materials are currently free for Massachusetts. but we're working on getting it permanently free for Massachusetts. However, they're currently free. As you can see, we're one of the states listed. So you can take out your phone and go using the QR code or using the website. Order promo posters in English and Spanish, how-to posters in English and Spanish, app card reminders, brochures. Go to the site, take a look at our saves, download whatever material will help to continue this process. Just go to www.counttthekicks.org and click on order materials. Fill your cart. We have all of these wonderful resources right at your fingertips. The purpose, we also have a wonderful continuing education training that'll help you to continue to save babies with us. It isn't yet free for Massachusetts, just know that we are working on it. The purpose of this educational activity is to train healthcare professionals on how to talk to their patients about fetal monitoring and using the best practices to track monitoring. By using an evidence-based and non-invasive tool, providers can help to prevent stillbirths. This is a low-cost training that can be accessed at bit.ly/SaveBabiesCTK. And once again, it's a low-costing tool. We're working on it. Hopefully we'll be able to come to you soon and say, guess what? It's free. Someone in Massachusetts has funded us. Yay. Next slide.
That would be awesome. And just so you know, I'll share these links so it's easy for you to also order materials, download the app, and access this training. I'll share these links in the follow-up email.
So as we've touched upon, we have so many free resources available on our website. Again, counttthekicks.org, from a parent academy, a provider academy, Count the Kick charts that can be printed out in English and Spanish, videos on how to use the app and educating folks on it, as well as our Count the Kick ambassadors. NECA and I are obviously your Massachusetts ambassadors, but there are so many more. So really, again, what is a Count the Kicks ambassador? We are, again, as I mentioned, located across the US. We volunteer our time because we're passionate about maternal health and saving babies. It's driven by my own experience of losing Xavier and going through 2 rainbow pregnancies. Without this information, NECA, I know you are also fueled by your own experience. And we are attending a number of different events to be trained and educated. We attend medical conferences, baby fairs. We'll do interviews with media. We will work with local providers to develop partnerships, fundraise, and so much more.
If you ever want to access Sam and NECA, I will also share their emails. So know they are valuable resources. They're boots on the ground. They're passionate. They're making a difference. And honestly, our organization could not have the national change that we're seeing without Sam and NECA and their team of Count the Kicks ambassadors. They are on our website as well. So next steps, we are nearing the end. We'll have a chance to answer questions as well, but I really want to highlight, what do we want you to do today? If you haven't already downloaded that Count the Kicks app, please do. If you're working with expectant parents, it's important you know and understand the free Hallmark tool that's at their fingertips. If they don't have access to an app, they can download printed kick counting charts. And those are actually coming in English, Spanish, Haitian Creole, and most recently, which our ambassadors don't even know, just found out yesterday, Navajo and Swahili are also going to be available. We continue to work with partners around the country to break down barriers so that everyone has access. So download that app and practice, 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 share, share, share. Nothing would make NECA happier and Sam happier than to see orders come in as a result of this presentation, because they know that then materials are going to be the hands of moms, and we know that women will be saving their babies and potentially their own lives. So thank you for teaming with us. Thank you for getting these materials on the walls of clinics, in community centers, and libraries. There's no space that doesn't intersect expectant women that these materials should not be provided. And because for right now, they're free. And like you said, we're working on a long-term relationship, hopefully to get these funded further. You can go to www.countthe.kicks.org to order them. Again, thank you for partnering with us in that way. Please, if you are in a healthcare provider role, take 3 to 5 minutes with your patient to educate. Make sure to have that kick counting conversation in every appointment in the last trimester of pregnancy. Make sure your entire staff knows about the campaign and the importance of tracking fetal movement. Use your EMRs, your electronic health records, your intake forms, update your discharge paperwork so that when somebody goes home after a concern, they have that information about kick counting and count the kicks in those papers. Wherever you can weave it in, it takes multiple touch points. So please find ways to weave it into the work you're already doing. And we know you're doing great work and on behalf of moms and babies in Massachusetts. And remember, hours and minutes do matter in preventing stillbirth. Make sure you take the time to educate patients and staff about how to expedite those concerns about movement. So we do have a quick video, and since we're short on time, I'll send a link to this video out. So I'm going to just move past here, but it is about our baby saves. So we have nearing 100 baby save stories on our website. We get these baby saves completely organically. They do come to us because of HIPAA laws. They come to us just because people share their stories and they're powerful. So I encourage you to go to our website and read that. I also encourage you to connect with us on our social media channels and learn more about the work that we're doing and ways that you can integrate Count the Kicks into your work. We want to help save babies with you. And I am so grateful for Sam and NECA for joining me today. And we are more than happy to answer questions at this time. Sam and NECA, do you have any closing remarks?
Just thank you to everyone who has come, and I'm excited to see us start to move the needle in the state and save more babies.
And I have a quick activity. I want everyone who's here to unmute quickly, and I want you to say one thing. Hey, Massachusetts, have you counted your kicks today? This should be on everyone's tongue. Every time you see a pregnant person, have you counted your kicks today? Let's save babies together.
Wonderful. Are there questions that we missed in the chat? I was not doing a great job of checking that, but if you have questions, now's the time. Sam, did you notice something that needed to be addressed?
Well, one question that came up that I don't believe I have seen, but it was specific to the myths that we were sharing. If that exists anywhere in materials that could be printed out or already are in a brochure or a poster.
I do not believe we have those in printed materials, but it's an awesome idea. Mythbusters are a big thing to us because we know, especially the internet exasperates that. And even that generational storytelling from woman to women to women, sometimes they share what they've been taught, right? I certainly I had a lot of these myths in my pregnancies that had been shared by other women, unbeknownst to them, without any ill or malice, they were sharing those myths. So that's a great idea. But no, we don't have anything necessarily in printing, although they are part of the parent and provider academies on our website.
So someone could theoretically copy, paste, print.
And we highlight those on social media channels that they're really important because a lot of our ambassadors, like Sam referenced, like NECA referenced, believed those myths. And that is one reason why they did not seek the help that they were hoping to, that they needed. They didn't realize the warning signs, and it was a barrier, right? The myth became a barrier to care. So we don't want to exasperate those myths. So we're trying to bust them. Thank you. Any other? I love your ideas. I love your interaction in the chat. Sam and NECA are boots on the ground. I'm accessible. I'm going to share this recording. I'm going to share the PDF of the presentation. I will make sure there are live links to the white paper and to the CE training and to all the things. So if you have not got any further questions, please do reach out if you think of something after this. All scales. Actually, the story I was going to show you about Dana, I'll link it. So somebody said put a picture above all the scales. It's an excellent, excellent idea. The story I was going to show you about Dana saving her daughter Nala, that's exactly where she learned about Count the Kicks. It was at the scale she weighed herself at every single prenatal appointment. And she was able to get Nala here safely because of that. So cool that you're already on top of it. You guys are brilliant. We could not be more grateful. Again, we're accessible and we just thank you for your time today.
Yeah, and feel free to reach out to any of us. We're ready, willing, and able to help meet, talk, brainstorm, and get the word out and affect change. Let's save some babies.
Thank you, everyone.
Thank you, everyone. Have a great rest of your day.
Have a great day, guys.
Bye-bye.